Awesome. Well, welcome in, everybody. I'm sure we'll have people continuing to trickle in, but we are so excited to get started today with why nurses make the best entrepreneurs with our special guest, Ilana, here. Just to do some housekeeping before we get started, my name is Haley. I'm the marketing lead here at M7 Health, and I am in charge of all things webinars and events. So just kind of want to give you a lay of the land before we get rolling today. Today's webinar is going to be from 1 o'clock Eastern time to 2 p.m. It's going to be about 30 minutes of moderated discussion between myself and Ilana. During that discussion, we're going to cover all kinds of amazing things about her journey. But if you have any questions that pop up, we are going to have about 15 minutes of audience Q&A at the end. But as those questions come to you, feel free to post them in the Zoom Q&A function. Don't feel like you have to wait until the end. That way we'll have some to get started with once we get there. Also, as you can see, the chat function is turned on today. We'd love it if you all would communicate with each other in the chat, throw any comments or thoughts in there as we go along, and maybe that'll help guide our discussion a little bit. Also, if you have any friends or colleagues or you have to jump early, no worries. We are recording today's presentation and we will be sending it out via email to anyone that registers for the event following the event. So even if people weren't here today, they will be able to check it out on demand. And one last thing before we get rolling, we do have a short post-event survey that'll pop up on your Zoom account as you leave. It's like 3 questions. It'll take you 30 seconds. But this survey is really to get an idea of what you all are thinking of these events and what kind of events you want M7 to host in the future. So it really, really helps us to make sure we're catering this content for you all in a way that's going to be as valuable as possible for the little community we're building here. So with all of that out of the way, I think it's time we get started. Allow us to introduce ourselves. I'm going to throw things over to Ilana to just give you the sneakest peek at her background before we dive in. Ilana, you want to introduce yourself to the group here?
Sure. Thank you, Haley. So hi, everybody. My name is Ilana. I am a registered nurse and the co-founder and CEO of M7 Health. As you all know, even just from the event title, I am super passionate about nurse innovation, nurse-led innovation, and supporting more nurses into pursuing entrepreneurship similar to the way I have. So really excited to talk a little bit about my journey today and answer any questions that pop up at the end of the conversation.
Amazing. And then I already kind of gave my role here at M7. I am M7's marketing lead. I just joined about 3 months ago, and I'm so excited about the growth and everything that M7 has been doing over the last year, and kind of where it's going to go in the future. I come from a performance background, and I'm very much a creative at heart, but I have kind of ended up in the startup world. I recently was working at a mental health startup and was really looking to make my next step into something that was just really, really mission driven. And I've been so impressed with Ilana and Eric, our co-founder here at M7. So I was really excited to join a company where there was entrepreneurship for the sake of something that means so much to Ilana. I think that those are the companies that are really going to be making a huge difference in their fields. So I am really stoked to be here and really excited to have this conversation with you, Ilana.
Let's do it.
Awesome. I'm going to stop sharing my screen because this is mostly just going to be a chat. But as I said, use that chat function to join in our discussion, and we'll keep an eye on things. And then, like I said, as questions pop up, use that Q&A and we'll get to those at the end. But I'm going to stop sharing. I'm going to pull up my questions and we're going to dive on in. Sound good, everyone? Amazing. All right, Ilana, we're going to start just by going through kind of like your story of how you've ended up here. So as you said, you're a registered nurse. What drew you to nursing in the first place?
So for as long as I can remember, from the time I was a little girl, I knew I wanted to do something in healthcare. I had no nurses in my life, I had no doctors in my life, but I was always drawn to the idea of a profession that was revolved around caring for others. I was also always into science and just fascinated by, the brief anatomy sections we would have in our science classes in like middle and high school. And when the time came to apply to college, I was in high school when the ACA, so Obamacare, was signed into law. And I was like, maybe there's a way I could have impact on the healthcare system beyond being a doctor, which was like the first thing that came to my mind when I thought about what I would major in college. And so I started exploring opportunities in healthcare. I was actually visiting a friend who was being treated at Memorial Sloan Kettering Cancer Center, and I met her nurses. And her nurses were delivering patient care to my friend, amazing patient care, by the way. And as I got to speak to them, they were all telling me that they were doing these really cool things outside of their day job, right? So outside of the shifts that they were working 3 shifts a week, many of them were getting PhDs, were becoming nurse practitioners. One was working as an expert witness for a med mal firm, like a law firm. And I was just like, holy cow, this nursing profession would enable me to go to school for 4 years, graduate with a bachelor's, immediately deliver patient care, and have all the versatility in the world to touch the healthcare system at several different angles. So, as a very eager 17-year-old, I said, let me go and pursue that. I could jump into clinical rotations my freshman year, Penn's nursing school, where I went undergrad, enabled you to do that. And so I ran with it and have never looked back and have really taken advantage of all of the versatility that the nursing profession has to offer.
Yeah, absolutely an amazing journey. Just the idea that this is something we hear a lot with like everybody at M7. I don't know how familiar everyone else is with the company, but we have so many nurses that work here, and so many of them just talk about the reason that they went into nursing is because they had just a fabulous interaction with real life nurses and realized, oh my goodness, like this is something that I could find myself being really passionate about. So take us through your journey post nursing school, because I know you, that you didn't go straight to the bedside. What kind of was your unconventional path
Yeah.
there?
So despite the fact that I loved my clinical rotations in college, as I mentioned before, part of what kind of piqued my interest in doing something non-traditional in healthcare was the Obamacare being signed into law. And then when I was a sophomore in college, the Obamacare exchanges went live, and I was just like such a health system nerd. I wanted to do something that would really be able to impact how health systems were responding to this new legislation. And so I went to Penn. They had a healthcare management minor as part of my BSN major, Bachelor of Science in Nursing major. And those classes had Deloitte, the healthcare consultancy, coming and recruiting from those classes. And so I ended up applying to a role at Deloitte as a healthcare consultant with the idea that I would be in the group that was helping health systems strategize about how they were going to change policies and operations to meet, Obamacare's mandates. I didn't end up being put on a single project related to the ACA, which is ironic. However, the next best thing happened to me, or actually something even better happened to me. I was put in a human capital consulting group, which meant in practice that they sent me and a team into these large academic medical centers that were implementing, for the most part, Epic. So they were implementing the EMR for the first time, or they were implementing new policies and new procedures that impacted the clinical workforce. And again, as a 22-year-old healthcare consultant, they sent me out onto the units of these hospitals to actually facilitate training for frontline nurses on how policies or procedures needed to change or how they needed to get up to speed in using Epic. I never could have imagined how incredibly helpful that experience would have been for what we're doing now here at M7. But all that is to say, I did that for just shy of 3 years and loved interacting with nurses every day and was honestly like jealous of how they got to spend their days because they were delivering the patient care, which was the reason that I went into nursing in the first place. And so I decided to leave Deloitte. And I looked for jobs in New York City. I knew I wanted to be a nurse in New York City, and I went to Memorial Sloan Kettering Cancer Center, where I was initially inspired by the nurses. And those nurses played an influential role in encouraging me to pursue a path in nursing in the first place. So I took a job as a night shift nurse on a bone marrow transplant unit called M7, which is where the name of the company comes from. I worked with the most amazing team there. I think one or two of you might be watching right now. And while I was there, it was some of the most fulfilling work I'll ever do in my life. I loved clinical delivery, but I have always been a problem solver, and there was a problem that I saw that I simply like could not stop obsessing about. The way staffing and scheduling was done was wildly, wildly inefficient and highly manual. And we had an assistant nurse manager on our unit who did an amazing job with it, and but it took her an enormous amount of time.
Mhm.
So I ended up deciding to apply to business school because I knew I wanted to solve this problem that impacts the entire nursing workforce throughout the country, but knew I was looking for some skills to round out my clinical experience. So I ended up enrolling at Harvard for business school, where Eric Gruskin was a classmate of mine. He is now the co-founder and CEO of M7. And Haley, I'm happy to tell you more about how he and I kicked off the journey of starting M7 and ultimately building it to what it is today. But that is the short-ish version of my journey to date.
Amazing. Yeah, kind of an unconventional path. And I already see we have a question later about kind of getting your MBA and what your thoughts are on that, but we'll get to that later in the discussion. I want to hone in on something that you just mentioned about your experience at MSK and seeing this issue with scheduling, and just like you ended up at the bedside and you saw this problem, and what made you want to change things? Like, what conversations were you having? What kind of like spurred that need?
Yeah, so there are a few things. The first is, as a nursing profession, we really pride ourselves on doing every single thing for patients in an evidence-based way and in a data-backed way. There's research on pretty much everything we do to ensure we're doing best by our patients. Having come from Deloitte's human capital consulting practice, I know that there's research and there's best practice for how you manage, organize, support, deploy a workforce. And it was kind of crazy to me that very little of that was applied to how we manage, support, organize, and deploy ourselves as a nursing profession. Like, we don't apply the same rigor to caring for ourselves that we do to caring for our patients. And you know, we're ultimately in the business to take care of patients, but you have to put your own oxygen mask on first, right? So that's what got me thinking. Like, I know there's a better way to do this. The other thing is that a nurse's schedule, not only does it take an enormous amount of time for nurse leaders, our most expert, most experienced clinicians amidst a nursing shortage, they should not be spending time behind the closed doors of their offices, essentially completing a math problem that's near impossible to solve, right? But also the outcome of those schedules is so critical in making or breaking an experience for a frontline staff nurse, right? Like, if your work-life needs are not met, or if they're not met some of the time, right? Maybe they can't be met all the time, but they need to be met at least some of the time, or else that nurse is going to leave that job and look for employment elsewhere, right? And amidst a nursing shortage, every health system has to prioritize creating an environment that their staff want to stay in and want to work in. It's what's right for the patients, it's what's right for the nurses, and it's what's right for the hospitals. So that's how I knew this was a problem worth solving, that I felt uniquely well suited to solve because of the experiences I had had to date, and that I just knew was important.
Yeah, I think that the question now is, you saw this problem and you had an idea for a solution. And I think this is probably something that a lot of people joining today have this question of like, did you always see yourself becoming a founder? Like, did that idea come later? Did you think maybe you could solve it from the inside? What
Yeah.
what kind of led you to be like, no, I need to go forward with this?
I would call myself like an obsessive problem solver my entire life. When I see something that just isn't right, I can't stop thinking about it until I'm in the process of solving it, right? And
Mhm.
and I can stay very focused and very motivated until that problem is solved, which is like a great attribute of somebody who takes on the founder journey, right? But for me, this wasn't about like being a founder or bust, right? Like, I didn't need to start a company for the sake of starting a company. I saw a problem that I felt so compelled to solve, and I felt uniquely well suited to solve it, right? And I knew that my nursing skills would be critical to being able to solve it, and so I took the leap. Although, Haley, we can talk about this later, but I always like to encourage people who call me and ask me about their entrepreneurial ideas, and they say, "Should I take the leap?" My answer to them is always like, it shouldn't feel like a leap. You should feel like you are so pulled toward it that you're actually not jumping, you're just pulled. So I felt pulled toward founding what M7 has become, which by the way, has evolved significantly from what I thought the solution was going to be when we started. But yeah, I think I've had attributes of what a founder needs to have my entire life, but it wasn't like necessarily the plan.
Yeah, no, that makes sense. And I think that's really great advice to help people not feel like they're floundering in this decision. And I think we're gonna kind of get to the meat of the conversation right now, which is like you specifically said, like, I feel like I had these qualities to be a problem solver and be a fixer. And I think you've told me this and we're going to discuss it now, but a lot of nurses have those qualities. So what skills from nursing have translated to startup life, and why do you think nurses are uniquely positioned
Yeah.
to do this?
I will sing this from the rooftops any day. I strongly believe that the skills we are trained, both in nursing school and in our first couple of years at the bedside, uniquely like position us nurses uniquely well to be successful in an entrepreneurial journey. And there are several reasons for that, right? The first is we are constantly working with limited information in very high stakes settings, right? So when you're taking care of patients, it's obviously high stakes, and you have to make you have time pressure to make the right decision for your patients, and you might not have all the information. Maybe your patient isn't verbal. Maybe you are calling some sort of subject matter expert. Maybe it's the physician on call. Maybe it's the respiratory therapist. But if they're not in the room with you, you have to make a decision that's best for your patient with the information that you have in front of you. And it has to be a risk adjusted decision as well, because the stakes are very high. That is not experience or a skill set that most young adults, and by the way, you could go into nursing later in life too, and this still applies, but that is not a skill set that many people get to hone so early in their career the way nurses can, right? So making high stakes decision with imperfect information, working with multidisciplinary, interdisciplinary teams, right? As a nurse, you know what you know, and you know what you don't know, and you have to be very resourceful at what we used to call in my unit like hunting and gathering. So a huge part of your job and your shift is hunting and gathering for the right resources, which could literally mean like the right supplies in the supply closet, or running upstairs to the unit that more frequently sees the types of drains that your patient has, and you need the right tooling to take care of that drain. Like it could mean that, but it could also mean like we need to call the cardiologist on call, or we need to call the like the derm attending on call, right? So it's always thinking about looping in experts who know something that you don't know. And that is 90% of what I do as a founder, right? It's being ruthless and prioritizing which problems to solve, and finding the right tools, the right subject matter experts, and the right experience to help me solve that problem, right? This is the first time I'm a founder. We still have a lot to prove, but we've come a long way. And that's all because I have tapped into my network and my network's network to try to get answers when I don't have them. Another thing I'll say about nursing is like we have to be professionals the day we start our jobs, right? Showing up
Mhm.
on time, leaving like not leaving until the job is done, communicating with people that are that are in distress, communicating across cultures, across age groups, across level of experience. Again, that is not something that everybody gets so early in their career, and we as nurses get it from our first day on the job. And I think that like being able to interact effectively with people is critical to anything that you do, especially entrepreneurship.
Yeah, I think it's transferable skills are like the name of the game. And there's there's so much training that is like copy paste, and it's just about having the mindset of understanding that those things live within you, you know? So I
And wait,
guess,
one other thing I'll just
yeah.
say, because I hear this from nurses all the time of like, you do the business thing, like there's this mentality of like business is over here and clinical is over here, right?
Mhm.
I tell them all the time, like, if you have a problem that you want to solve that you can't stop thinking about, I swear to you that like Microsoft Excel and PowerPoint and Tableau and any of these other tools that you have to learn how to use to be effective in the business world are so much easier to figure out than the vents that you manage every day, how to transfuse a bone marrow transplant, right? Like passing the NCLEX, all these things that we have to do as nurses are so much harder than figuring out the tooling that you need to effectively operate in the business world. So I really encourage everybody to believe in yourself and have the confidence that you can figure it out if you figured out how to be a frontline healthcare worker.
Yes, no, I I believe that. As we hop on here and you're like, how does Zoom webinar work? I'm
Yeah,
like,
literally.
you'll be
I'm still
fine.
figuring out Zoom webinar.
You'll be okay. So now let's talk about kind of the environment of being a nurse and then wanting to be an innovator. What do you feel like nurses are encouraged to innovate? Or is that something that's like encouraged by their hospital administrators or their managers?
Yeah.
Or where do you think that kind of relationship is going?
I think that nurses are required to innovate at a small scale every single shift, right? Like you have to solve problems in new ways for your patients pretty much every single day. Innovating at scale, so like moving an innovation that you created for one patient to your unit, or moving it from your unit to your entire service line, or to your entire hospital, or to your entire health system, or to the entire US, is a conversation that has picked up significantly in the 4 or so years that I've been working on M7. So I do think that there are now innovation teams in many of the large health systems throughout the US that are coming out literally every year with new resources, new programs to help support aspiring nurse innovators. There are also some external parties that have been so influential in my journey. I have a couple like specific people to shout out who have all been involved in Sancial, which is a link that Haley, I think we can drop in the chat before the end of the webinar. But Sancial is an amazing organization that's promoting nurse-led innovation and entrepreneurship. And Marion Leary from Penn Nursing, who's been involved in that, has been an incredible mentor to me and to so many other nurse entrepreneurs. Rebecca Love, Hiam Nadell, Paul Coyne, they all have really been trailblazers in creating programs for nurse entrepreneurs like myself to really get our ideas off the ground. They're also just very willing to reach out to respond to cold messages, as am I. Johnson and Johnson also has amazing programs to support nurse innovators. And Haley, I think we can drop in the chat. They have a program called Nurse Hack for Health. There's an info session next month in July, and applications are due in August. You can win up to, I think it's like $150,000 in grant funding to pilot your innovation. And they also give you coaching along the way of how to form a pitch deck and how to create a budget. So many things that Eric and I benefited from. We actually won that competition back in 2022, which was really the launching pad for the whole company. So Haley, to answer your question directly, the tune has changed in the healthcare ecosystem over the last several years. I think nursing is getting more attention, and the unique vantage point we have at the healthcare delivery system enables us to bring unique innovations to the table. And now we have resources to help us do that.
Amazing. I just dropped those links in the chat for everyone, but I'll send them in the follow-up email as well. So
Yeah.
just be on the lookout for those. I guess these are some great like organizations outside of the hospital system that people can turn to, but I know we even have some like hospital administrators on the call today. Is there anything the health systems themselves can do to better support this nurse-led innovation?
Absolutely. So I think that so I know that there are several nurse innovators out there who got an idea while practicing. They got it off the ground to pilot it at a slightly larger scale. And then they got caught in what we like to call the like death by pilot trap, right? So it's like if you pilot something and trial something at a medium scale in your hospital or otherwise, you need to be very clear about how we're defining success, right? What are the measures of success? And so for health system administrators that are on this webinar, if you can support your nurse innovators in defining what success would look like and kind of what that threshold is and what that barrier to expansion is from the get-go before you start a pilot, that sets everyone up for success, right? So perhaps it's user engagement, right? We need X% of users who have access to this innovation to use it at this cadence in order to define it as success. Or we need to see out of this P&L that you have saved X thousand, X million, whatever it is, dollars by this time period. And if the answer to that is yes, that you have, here's the next group of employees or the next group of patients that we move to pilot this even further or to expand this even further. And so you hospital administrators, if you can help your nurse innovators understand the mile markers, understand the metrics of success, and mutually handshake on it, ideally sign on it before you even get the pilot or the test off the ground. It sets everyone up for more success and for less disappointment.
Amazing. Yeah. And Nikki had a great comment here just talking about there are many chief medical informatics officers in health systems, but not many chief nursing informatics officers. And just that idea of championing innovation from the nursing side is going to be integral to this.
And also, Haley, so that's a great comment. And in response to what you asked earlier of our health systems supporting nurse-led innovation, I have to tell you, I am seeing more and more chief nursing informatics officers roles being filled at hospitals for the very first time. Like the number, I don't have the stats off the top of my head, but the number has most definitely increased over the last 4 or 5 years that we've been working on M7. And at the hospitals where they have those positions filled, they are typically the strongest champions for what we're doing here at M7 and for what other nurse innovators are doing out in the market.
Amazing. Okay, we're going to shift gears a little bit into more of like the tactical, like product build, like portion of bringing your innovation to market, basically. You obviously have this wonderful product, M7. What were your first steps in validating the idea behind M7?
Okay. So again, this is one that I like sing from the rooftops all the time when I talk to aspiring nurse entrepreneurs. Never start by building the solution. The first thing you have to do is validate that the problem that you see is the problem that everyone else sees, right? So I saw that scheduling was taking a really long time on my unit, right? But what the first thing that Eric and I did when we teamed up in an HBS class to explore this problem, not to solve this problem, to explore this problem, was we set up calls with about 200 nurse managers throughout the country. And we spoke to about 200 people and asked them, how do you build your schedules? What do you like about it? What don't you like about it? And long story short, we found remarkable consistency in the pain points that people were feeling, right? Like remarkable consistency. It was terrible for the nurse experience. It led to turnover or retention when it was done well, right? Like I'm spending days, if not weeks, on trying to build and manage a schedule. We have 5-6 conference calls a day. We were hearing the same thing almost verbatim from nurse managers who were in, labor and delivery departments, and nurse managers who were on bone marrow transplant units, and nurse managers who worked in very rural, small community hospitals, and nurse managers who worked in some of the largest metropolitan urban hospitals in the country, right? So we were like, wow, we are onto a problem that we feel confident is ubiquitous. And then we said, I'm not a software engineer. Eric's not a software engineer. We don't know how to write code, right? But we said, okay, we have an idea of what the end product should look like, right? Like we think we know what a fair and balanced schedule looks like and what data would be helpful to visualize. Let's just like mock it up. So we called this Wizard of Oz testing, right? Like we asked the nurse managers who were willing to pilot with us. And again, this wasn't like a formal pilot. We just said, can you send us like a screenshot of your paper schedule? We're going to balance it for you and give you the output of what M7, wink, wink, like what M7, the product that doesn't yet exist, could do for you. So we took it behind the curtain, and Eric is an Excel guru, and he was balancing schedules and adding all these very cool analytics and visualizations. We formatted it really nicely in like a PDF, and we emailed it back to the nurse managers. And we said, like, tell us what you think. And so people absolutely loved what we came back with and asked us to do it the next schedule cycle and the next schedule cycle. And long story short, that was giving us conviction that we were really onto something. And there's a name for this, and it's called the fake back end. So if you're building a technical product and you don't actually have the technology as the engine just yet, you can fake the back end to give your users the output and validate that you're even working toward building the output that your users want in the first place.
Wow. No, that's incredible advice. I think being able to pilot the idea in action before building the technology, you just know you're set up for success. And I think this kind of goes back to what you were saying before about like having these conversations and validating that there is a problem and that there's a problem to solve and how you can solve it. It really does come down to like having those conversations. You don't necessarily need to have the tech all figured out right from the get-go, basically.
Yep. And even this applies, by the way, even if it's not a software, even if you want to build a medical device, for example, it's like literally tape it together with the supplies you have in like in your hospital supply closet to try to emulate what it will do or what the shape would look like to go ahead and get feedback from who you believe your end users would ultimately be. And if you are really honest with yourself about what you're hearing in response to what you're putting in front of people, it will save you a lot of time and heartache later down the line when you've made a much bigger investment, both in time and in money.
Yeah, absolutely. Well, so now that M7 is up and running, or we're a company, we're in hundreds of hospitals at this point. What's the most important lesson you've learned now that M7 is live?
That okay, the most important lesson I've learned, I've learned so many, but the one that immediately comes to mind is that like you're never done building, right? So like Eric and I had conviction back in the early Wizard of Oz testing days that we were onto something, and we certainly were. But you know, we got feedback that led us to evolve and change and advance the product. And now that we're live, like Haley said, in like dozens of hospitals now, we're still listening to what our users are telling us every single time we go live at a new hospital and every single time a new schedule is published, even from our earliest customers, getting their feedback because the market evolves, needs of users evolve. And if you really nail a user experience, as I believe we have here at M7, it leads them to say, wow, M7 got me from point A to point B. Do you think they could get me to point C? Like I never told them about that problem that I have, but this downstream problem, maybe they can tackle that too, right? So I would say the biggest thing I've learned, Haley, is that like as an entrepreneur, you're never done. You're never done, right? Like even like think about like Apple. Apple is never done. There's the iPhone. I think we're at iPhone like 15. Like there's always the next best thing to help push your mission further, faster and further. And that I guess maybe should have been obvious to me before I started, but I've felt it to my core over the last few years.
Always iterating, always improving, always moving forward. Absolutely.
And
So,
staying close to your users to do that, right?
yes. Yeah. And this kind of brings me to my next question, which is you did this pilot, you validated the problem, you validated there was a problem to solve, you went, you built this product. Now you're selling it, I guess is the question. And I think a lot of entrepreneurs have this question as well of like, how do you think about ROI, especially when it's really hard to measure? I would say when we're dealing with something called like scheduling, but when you're really dealing with solving any problem, at the end of the day, you're going to have people asking like, is this worth it?
Yep. So this kind of goes back to what I was talking about with how hospital administrators or executives can support aspiring nurse entrepreneurs or nurse innovators is define the problem, define success, and align on how you measure the delta between the two before you get started, right? So for something like an M7, it's are we saving time among schedulers, right? Are we improving satisfaction among staff, right? Are we saving costs for health systems? And what are all the different subcomponents of those? Outline them, ensure that there is mutual agreement on where we're starting, and ensure that there are clear milestones on when we are going to test the impact of the intervention and what the testing methodology is going to be, right? So that's how you do it. And again, it really depends on who you're selling to, right? Because if you're selling to some of you out there might be selling something that you need to get patients on board with, right? It might not be like a physical product or a software product. This might be a new policy, a new procedure, a new way of engaging with patients, right? And like that's innovation too. It might be a new care model. That's innovation too. But how are we going to measure whether it's working, right? And I think you have to typically assemble an interdisciplinary team of people and ensure that everyone from all disciplines involved agree that you're measuring the right way. And I would recommend establishing meeting cadences before you start to ensure that everybody has these expected milestones of how we're going to align on whether we should keep going or whether we should fail fast. And by the way, failing fast is also okay. Failing fast is a whole lot better than failing slow, right? So, I hope that answered the question, Haley.
No, I think that's great. And I think we have some follow-up questions coming in, but we'll get to those in a second. Just for everyone's reference, this is our last question as part of this discussion. So if you've had things that you're drumming up in your mind, feel free to throw them in the Q&A. This question is a bit um, internal and feels selfish for me to ask, but I'm curious. But like, how has being a nurse shaped the way that you lead the team here at M7?
Yeah. I mean, listen, being a nurse, some of the principles we describe at M7 that we look for in candidates to join the company are kind-hearted, tough-minded, and strong opinions loosely held. And I think that you need all three of those things to be a really good nurse, right? You need to be kind-hearted. At the end of the day, what we do is care for patients. We try our best to keep people healthy, and we care for people and bring people to health who have fallen ill, right? You have to lead with a kind heart in order to do that effectively, but you have to be tough-minded, right? Like you have to have a moral compass, a North Star, and understand that like health and well-being is the goal here, right? So that requires tough-mindedness sometimes because it's not always a pleasant journey getting to that end goal. And then the final thing I would say is strong opinions loosely held. As a nurse, you have to come in with a care plan and with a perspective on the best way to take care of your patients, right? Or the best way to take care of your communities if you're more in like the public health realm. But you have to have the intellectual humility to know that there are others around you who might know better or who might come in with a better perspective that is ultimately what's best for the patient. And those are the same principles we apply to the business, right? The business is the patient, and health, like the outcome of health for a patient is the equivalent of us having like a healthier, more well-supported and more sustained nursing workforce throughout the US. So those are some principles I bring into how I lead here at M7, and Eric lives and breathes those values as well. And I hope our team, many of whom are on this webinar, feel it in how we operate.
I love it. Amazing. Well, thank you so much, Ilana, for going through that discussion with us. I'm going to open up the floor now. If anyone has questions or discussion topics they want to cover, you've got the next 15 minutes to pick Ilana's brain here. Looks like we already have a couple that got dropped in. Okay, I think this is a great one. What are the pros and cons of getting an MBA? Do you think it's needed to pursue nurse innovation?
I'll answer the second question first. It is not necessary to pursue nurse innovation. It is certainly helpful, right? And a pro of pursuing an MBA is that you get the hard and fast business skills that, or, by the textbook at least, that many of us did not get if you pursued nursing as your undergraduate degree, right? So things like finance, accounting, strategy, leadership and management, right? You can certainly learn those without going into an MBA program, but is it helpful to have like dedicated time and a dedicated curriculum to learn them and case studies to practice with? Like, absolutely, right? But I think the more compelling case to go to business school into a formal MBA program is not the textbook learning, because you can do that online on like open source available classes today. It's the network that you build. So you end up in a class with, typically hundreds of other students from all over the world, from all different industries, by the way, which is really helpful for us in healthcare to like learn what's happening in other industries completely unrelated to medicine, to learn from and to network with, and it grows your network by leaps and bounds. And I never thought I would be looking to hire engineers, right? And like now I have a network of folks who have worked in these large technical organizations their entire career that I can reach out to for tips and tricks. And when we raised capital for M7, right? Like, reaching out to other folks from my MBA cohort who are founders themselves, who had negotiated term sheets, who knew the reputations of the different venture capitalists that we were considering bringing on board. That is really helpful to have that community of people that you can tap into, but it's absolutely not a prerequisite to being a nurse innovator or nurse entrepreneur.
I love it. All right, we have another one. This one's like really technical, just in terms like from the founder entrepreneurship side. But what tips do you have for nurse innovators to protect their IP and the equity split of their companies?
Yes. So protecting your IP I'm so glad somebody asked this. If you start building something or testing your innovation while employed at a health system, you need to speak to somebody in their tech transfer office, in their IP department, to ensure that you're very clear from the get-go on what you own and what the health system owns. Get get ahead of it, right? Before you start having real IP that is up for debate, right? So if you don't know who in your organization to speak with, you can reach out to your nurse manager, you can reach out to somebody in HR who potentially helped bring you on board, and they will direct you to somebody typically in a tech transfer office or in compliance who can help you navigate this. And if anybody has more specific questions on this, I'm happy to do a deep dive one-on-one. Or maybe
Amazing.
another webinar, Haley.
Yeah, that'd be a great kind of follow-up topic to this, of like really getting into the technical side of, if you're building a product, what does that mean business wise?
And by the way, I think like going to this tech transfer office, for example, is something that might sound scary to a nurse, like or unknown to a nurse. And it definitely is unknown to somebody who's only ever worked bedside and never dealt with legal and contracting. But like those systems are in place to protect both health systems, but the innovators themselves too. So this can be like a very positive, very collaborative discussion. It's just much easier to have those collaborative discussions and set very clear expectations the earlier you do them.
Makes sense. All right, we have a question in the chat, which is, would love to double tap into Ilana's point around M7 being different than the initial idea. What has changed, and how did she vet what was the appropriate North Star to follow?
Yes. So, I mean, the North Star has always been very clear, which is, build a work environment that is more sustainable for the nursing workforce, right? So we said, make nursing jobs work for nurses. That's always been the North Star. But the product that Eric and I started with was what we call a point solution. It's something that does one thing, right? And this point solution was that we would balance schedules. So the whole concept was an auto balance button, right? Collect preferences from staff, click the auto balance button, and give nurse managers a first pass of a fair and balanced schedule that's safe for their unit, right? That is still very much a part of what is in the M7 platform, but it's like this much of what's in the M7 platform now. So going back to something I said earlier, when we gave the fair and balanced schedules with fairness metrics back to nurse leaders, they were like, oh, this is good, right? Like now, can I see what the other med-surg units balance schedules look like so that we can maybe start like balancing across med-surg units sooner? So I'm just giving you an example, but we started getting asked for, oh, you've done this well. How about this next thing? How about this next thing? How about this next thing? So it's not that we ever abandoned what we started with. We definitely massaged it and tinkered with it. But we ended up building deeper and deeper into the work experience that we started building for.
Amazing. Oh, this is a great question from Lindsay. What are some strategies you found most successful at centering your end users as the M7 platform grows?
Yeah, so thanks for the question, Lindsay. I'm excited to talk about that. We have lots of nurses on our operations team, and a big chunk of the folks on our operations team actually go to the hospitals where we are going live and sit side by side with house supervisors, nurse managers, nurses themselves to train them on the platform. And as part of that training experience, we're listening, right? Like we want the activation team to be listening just as much as they're teaching and getting feedback from the users that are interacting with our platform. So that's a really critical part of what we do. And the other thing is we have this really wonderful program called the M7 Nurse Ambassador Program. And so we have nurses, I think some of you are on the call right now, who work jobs, who work full-time bedside jobs. And on their days off, they can work for us on an hourly basis and do a few things. So they're helping build more robust models for our scheduling algorithms. They also help give us product feedback ideas. We've had nurse ambassadors that help us do QA, quality assurance, which means that once our engineers and product team have built a new feature within the product, before we release it, so make it available to all of our users, we put it through rigorous testing. And nobody better to test a new product feature than nurses themselves, right? So we've had nurse ambassadors involved with that as well. And they've certainly caught funky user experiences or suboptimal workflows that we wouldn't have caught otherwise. So that's some of the ways we keep nursing at the center of everything we do.
Love it. Here's a little question about nursing schools. What steps are you seeing nursing schools take to incorporate entrepreneurial/innovation courses within their programs? And then kind of a follow-up to that is, do you think an RA or an RN versus /MBA dual degree is in our future? If you were to
Interesting.
design it, considering you've done both, what would it look like?
Interesting.
Alana's about to open a college.
Yeah. Let's start with the first question. So I have seen nursing schools really lean into innovation. When I was an undergrad in nursing school, Marion Leary, who I gave a shout out to earlier, who's a mentor of mine, she was just starting to talk about nurse-led innovation. Oh, did my video freeze, Haley?
Yeah. Oh, you're back.
I'm back, sorry. She was just starting to talk about nurse-led innovation and started the nursing innovation program at Penn, but there were no courses yet. There have been so many courses, so many boot camps, so many new programs that have gone live since then. I know Northeastern was also like a really big pioneer in nurse-led innovation. And I now know that most nursing schools throughout the country are baking innovation into their curriculums or offering bespoke classes specifically on nurse-led innovation. I would also encourage, for those of you who are in bachelor programs at schools that have other majors outside of just nursing, you can often cross-register and you can take entrepreneurial focused classes from, the College of Arts and Sciences is what it was called at Penn, but I'm sure they have equivalent schools at other schools. And you can lobby to have some of the credits counted toward your major. I did that at Penn actually back in the day. I took it was called Marketing for Social Impact course, which had a heavy healthcare subject matter. So I encourage you to look into that as well. The last thing I'll say is I was recently at a nursing conference and there was a really interesting conversation about how nursing schools, there's a consortium of nursing schools that are coming together to talk about how they bake education on AI into a BSN curriculum, right? So we're moving into a world where it's inevitable that documentation, especially, with ambient listening, documentation is going to change big time for nurses for the better, I believe. But understanding how to interact with AI, how to develop AI, and how to bake it into our workflow is something that we're all learning together, and they're going to have to start teaching it at nursing school.
I love it. Do you think there's an RN/MBA dual degree in our future?
I sure hope so. I do know, at least at Penn, they have a dual degree undergraduate program between the Wharton School, which is the business school there, and the nursing school. So you get like two bachelor's degrees together. The RN MBA dual degree, I haven't seen done yet, but I would be very supportive of it. So if anybody knows of a school working on a program like that, please connect me.
I love it. All right, let's see. Oh, I think this is a good question around just like not even entrepreneurship, but just this idea of like, why do more nurses belong in leadership roles? I
Yeah.
think we touched on it a little bit, but
Yeah.
would love to hear a little more.
I know that our unique vantage point as nurses, being the ones who are closest to the actual point of care delivery, makes us uniquely well suited to speak on behalf of the largest sector of the healthcare workforce, nursing, but also on behalf of the patient experience in a way that like no other functional area in a health system can, right? So if for no other reason, and there are so many other reasons, our proximity to patient care, which is why health systems exist in the first place, is reason enough to have the nursing voice at the highest level decision-making tables.
Yeah, makes sense. We have another question in the chat. As a final year nursing student, I'm excited by the digital and AI-driven tools you've highlighted, but also recognize the value of building a strong foundation at the bedside right after graduation. What concrete steps would you recommend for new nurses to, one, gain essential clinical experience and credibility, yet two, begin exploring, piloting, or even co-designing these innovative technologies so we can integrate them into practice early in our careers?
Yes. So the first thing I would say is get your hands into into your day-to-day job first, right? Learn how to be a nurse in the current system that your preceptor teaches you in, right? As you do that, take close notes. I still have my notebook from while I was in orientee, to track down all of the things that I saw that just like didn't make sense to me. I remember thinking like central line infections happened all the time. Well, our rates were low against national averages, but whenever central line infections happened on my unit, I was like, why are these not just coded in antibiotics? And I remember like thinking about it. I wrote it down in my notebook and thought I had like cracked the case on something like really revolutionary. And then when you like pick your head up from orientation and you have some time to revisit some of the problems that you saw or some of the solutions that you've maybe ideated on, you'll have more headspace to do research. I found that like a lot of people had thought about that before, and there was a lot of like mixed data on there about the efficacy of using antibiotic coated central lines. This is just a small example, but for, I think it was, is it Alia who just submitted that question?
Mhm.
Start by just getting really good at your job, take close notes, and then, like I said, you will be pulled to certain problems that are most compelling to you. And then that will lead you down the discovery path of what skill sets do I need to solve these problems and to fill knowledge gaps that I have in order to be equipped to solve those problems. I hope that's helpful.
I found it helpful. As I was saying, like one of the reasons that I was so attracted to working at M7 was because you were coming at this problem from a place of personal experience. I think that that is like an absolute game changer in the startup world of being like, no, 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 I've lived this problem. That's why I'm coming up with this solution. And that clinical experience cannot be overlooked or denied. Okay, we have time for one more question. And Jamie, I think this is a perfect one to end on. Ilana, what is your vision for M7's future? How do you see the platform continuing to evolve?
Yeah, so um, Jamie, thank you for the question. We have big, big goals for M7, right? So right now we are focused on nailing the staffing and scheduling experience and building better work experiences for nurses. That will always be at the core of what we do. And I think I know we are going to continue to build deeper and deeper into the shift for a nurse, right? Like, let's make every part of the nurse's job easier and more sustainable to enable all of us nurses to focus more on what we went into nursing to do, which was use our clinical judgment and deliver patient care in a way that like only human beings can, right? So anything that distracts nurses from doing that, we want to take off of your plate. And the other thing I'm really excited about is building a strong community nationally, internationally, of nurse innovators and nurse entrepreneurs, and really using M7 as a platform to encourage more nurses to solve problems that you see right in front of you that I know all of us nurses are uniquely suited to solve. And so this webinar is one like tiny, tiny step in that direction. But because M7 is growing so quickly and because we have tens of thousands of nurses on platform now, I think we are really uniquely well positioned to start this movement or continue this movement that other people have started. Um, I think that's it for now.
Amazing. All right, we are going to wrap up, but Ilana, is there any last thing you want to share? Anything that we didn't cover that you think is important?
No, I just really appreciate everybody taking some time out of their Wednesday to attend this webinar. And I think Haley just dropped an email address in the chat here. If you have any questions or want to chat more, shoot me a note. And I'd love to.
Amazing. Yes, as I said, we'll be sending out the recording of this event via email to everyone that's registered. This will also live on demand on our website. So if you have friends or colleagues that are like, oh my gosh, I missed that and I didn't get to register, no worries. They can head to m7health.com and check out the video of this. That is gonna be it for today. Thank you all, everyone in New York. Thanks for taking a few minutes with us, braving the heat in your tiny New York City apartments. And one last plug, as I said, as you leave the Zoom, there will be just a really short survey that'll pop up about the webinar. Please, 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 as Ilana said, we are looking to not only tell you about M7, but really build a community of people and nurses who are really interested in innovating in this space and having discussions about all things nursing. So leave us a comment there. Let us know what you think and have a great rest of your Wednesday. This was wonderful.
Thanks, everyone, and thank you, Haley.
All right. Have a good one. Bye-bye.